Hi, my name is Erik Grönvall and I come from the IT University of Copenhagen, Denmark. Together with Stefan Lundberg, I have written the paper Aspects of Pervasive Health and Technology Use in Care Organizations During the Pandemic, report from a municipality COVID study. The study is situated in a larger context, being a long-term research collaboration that we have with a group of Swedish municipalities. These municipalities collaborate today in an R&D center that they jointly finance, and their focus is on finding research and development potential within the social care sector. Our projects, together with the R&D center and the belonging municipalities, often focus on investigating the innovation potential within the municipality care sector, and most of our projects draw on co-design and participatory design methods. In these projects, we do a range of different workshops, including participants such as the care receivers, the care providers, but also next of kin and other relevant stakeholders when needed. We also do interviews, we do field studies and observations. Through our work, we, for example, have developed a platform for professional sharing and development for social workers, but also more tangible solutions like you see down on the lower right corner, where you have a musical instrument purposefully made to allow people with that lacks fine motoric skills to actually play and enjoy music together with others in a group. So while we were doing these sort of participatory projects in the municipality context, we, as many others, were all by sudden struck by the COVID-19 pandemic. And as we know, it in many ways have redefined our world and how we live our lives. Naturally, the COVID-19 pandemic also had a great influence on the municipalities that we work with in our projects. During the summer of 2020, the first wave of COVID-19 started to fade away, and it became a moment for the municipalities to start to reflect on what they have gone through and the lessons they have learned. Hence, our project was born. Together with the R&D Center and 13 municipalities, we started to plan a study that could collect and reflect on the lessons learned during the early phases of working with COVID-19. And there was an explicit wish from the municipalities to not only collect these lessons learned, but understand how these could be translated into resources to inform future crisis situations, being a pandemic or some other form of crisis. The original plan during the summer 2020 was to have an initial survey and a series of speculative design workshops where the municipality care managers could get tools and the opportunity to question norms, values, and best practices concerning both the pandemic, but also how they work in crisis situations. This plan, however, had to be slightly altered when we started to implement and work in this study as the second wave of COVID-19 rolled over Sweden during the winter 2020. What we ended up was one survey and one workshop. The survey was composed by three parts: a background information part, collecting general information about the respondents, a set of Likert scale questions that focused on the experienced effects of the pandemic within the care organization and the municipality, and 14 open-ended free text questions. The survey and the replies from the survey fed into an online workshop where we use Zoom and the web-based tool Mural. The workshops was divided into two main parts. First, we discussed the survey results and its implications, and then we had a so-called future workshop where the participating care managers could both collect challenges they had experienced working with the pandemic and try to turn these into possible visions and possibilities for the future. We will not go into detail about exactly what we learned from the survey and the findings here. You can read more about it in our paper. But to highlight a few findings, we can see that elderly care and institutional care posed most challenging during the pandemic for the participating municipalities. Also, the municipalities was not really prepared for a long-term crisis or a crisis that involved the whole society. This was something that stood out as something new for them. They also reported that Zoom and similar communication tools worked very well for them, especially within the organization, to have online meetings and so forth. But they also struggled with technology literacy level internally, but also with external actors like relatives for the care receivers. Going into the workshop and its findings, we can see that something that the participants asked for was, for example, a more creative process regarding risk analysis, where they also asked for clearer roles among the different stakeholders in the crisis situations that could enable new and better ways of working in crisis situations. They also saw that by having established communication plans, clearer messages, and repetitions, that could create conditions for a less stressful and more calm situation, both for co-workers and citizens. So, looking now back on our findings and discussing them, we can see that for the municipalities, it was a great learning to work with Zoom, Teams, Skype, and these sort of platforms. And overall, it worked very well for them. However, they mainly use these platforms internally and to a lesser degree with external stakeholders. They also mentioned that online teaching and web-based teaching became an important tool for them. For example, to disseminate changing hygiene routines for staff. That meant that the staff members could actually, when it suited them, orientate themselves and learn about new hygiene routines without needing to meet up at a specific training occasion together with others. Also, while not new, the e-commerce and e-shopping turned out to be a positive experience for the municipalities, allowing, for example, people to from a quarantine situation to order food, clothes, etc. online and have it distributed to their homes directly. Something also that came out from our work was a request and an identified need to have a better control and validation of information. The municipalities felt, for example, in some occasions, that there was a lot of misinformation within staff, within citizens in general, in the municipalities, and they had to fight this. So they asked for better ways of controlling this information flow and managing it. They had some experiences with remote monitoring of, for example, an elderly adult living at home using webcams, for example. This worked overall well, but they asked for more tools and more technology to help them doing effective remote monitoring. That said, they could also see that many of the systems that they implemented during the crisis or that gained momentum during the crisis could be categorized as silo systems. And while these worked well, Zoom, webcams, etc., e-commerce systems, they didn't naturally integrate well with the existing systems. So they become parallel systems instead of one integrated systems. So there is for sure a need to work with crisis plans that the municipalities have, and to constantly work with ideas of how this can be updated as a crisis develops, for example, in the long-term crisis situations. It's too early to say if some of the technologies implemented during the pandemic will continue to live on and be used after the pandemic, but it is very likely that, for example, Zoom and similar technologies will be used in the post-COVID situation. We can also see that many of the municipalities used new technology mainly within the organization for planning and organization support, but some technologies, for example, webcam and iPads, were also successfully used in care situations, but to much lesser degree. So here there are for sure possibilities to work further. And also many of the technologies used were not purposefully designed for care work, but applied in care situations. So here it's also a possibility and perhaps some challenge also for the pervasive health community to see how can we be better on actually providing and implementing and getting acceptance of purpose-made tools for care, right? In municipality care work, also in a crisis situation. So to conclude, we can see that our study has had a focus on the care providing organization, okay, and maybe not on the patient or relative, for example. And it's based on limited data, but we have tried to counterbalance that by actually working directly with people responsible for providing the care at the managerial level in the participating municipalities. It is clear that the municipalities during the crisis have both used existing and new technology as a resource, but they have experienced also challenges even using mundane technologies like iPads, for example, in providing care. One reason of that can be computer literacy, for example. There is a need from the municipality perspective to work on how to be better on providing and accessing trusted information, tagging information as trusted, and having routines for that. And we should remember that from a municipality care providing perspective, their focus is not on enabling technologies, but on the services where the technologies are being used. That's the main focus, right? So we should remember that when we try to design systems and devices for being implemented in care providing organizations like a municipality. So there is for sure an opportunity here within the field of pervasive health to design for social care organizations the specific needs, but we have to understand them, and we have to understand how these needs might change, for example, during a crisis. With that, I would like to say thank you very much.